Hello everybody, this is Dr. Nilekya, consultant physician at Akshaya Neuro Mutlispeciality Hospitals. Today I am going to talk about a topic which is very common and in fact whose numbers have reached to an epidemic proportion globally, that is overweight and obesity. What is obesity? Obesity is defined by World Health Organization, that is WHO, as abnormal and excessive accumulation of fat which causes health concerns. So what is the numbers which define obesity? Usually we define obesity based on body mass index, that is BMI. In Indian population we have a different numbers compared to the global population, that is 18 to 22.9 is considered as a normal weight, 23 to 24.9 is considered as overweight, and more than 25 is considered as obesity. What are the causes of obesity? Usually the most common cause we see nowadays is a person is having changes in their lifestyle, eating pattern and sleeping patterns. Of course, there are other medical concerns or medical causes which cause obesity and overweight. They might be thyroid issues, there must be Cushing syndrome, there must be hyperinsulinism or genetic issues, of course. But these are all very rare. The most common condition is mainly the change in the physical activity, dietary pattern and behavioral pattern of a person. So why is obesity such a big concern? That is because obesity causes so many health issues in a person. It might be a lung issue like obstructive sleep apnea, it might be a heart issue like heart attack due to abnormal cholesterol levels, or a brain stroke, or any other orthopedic conditions like recurrent knee pains, osteoarthritis, backache, or recurrent strains on the body. This and all. Apart from this, liver causes like fatty liver disease, or gallbladder cause like cholecystitis or cholecystithiasis or gallbladder stones. And in females it also is known to cause infertility because of polycystic ovarian syndrome. So because of all these concerns, we have to address obesity. It is to be managed. It can be managed mainly by changing the behavioral pattern, that is by changing the diet, by changing the physical activity pattern in a human being who's having a obesity. So physical activity might be like the person or the patient of obesity should always be motivated. They should be motivated to have appropriate amount of physical activity every day. They should be patient enough that the weight gain has not taken over days. It has taken over months or years. So the weight loss is also going to take over months or years, but it should be persistent. So that is the reason why we advise everyday physical activity around at least 30 to 45 minutes a day is minimum required, or depending on the person to person and the amount of weight loss we are targeting or we are reaching, we want to see. Apart from that, diet also is recommended. There should always be a balanced diet including adequate amount of carbohydrates, fat, proteins, and make sure that the required amount of minerals and vitamins are also included. There are diets like high fat diet or high protein diet or low carbohydrate diet, but the balanced diet is always the better option. Even though it takes time, it's a healthier way of losing weight. Apart from that, if somebody is having severe obesity or obesity with other conditions like diabetes or hypertension, they will require, of course, some surgeries which are called as bariatric surgeries, or some injections or tablets, medical management. But before that, we should always try, and along with that also, even if we go for other options also, there's always the crucial role is played by the changes in the diet, healthy diet, and also the physical activity. That's all for today. Thank you. All of you, please be active, stay healthy, eat fit. Thank you.